Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. For those of you who don't know me, my name is Raihan Firda Zaen. I am the student of Faculty of Medicine, Sultan Agung Islamic University, Indonesia. As you can see on the screen, the topic of our presentation today is the common errors in focusing the light on the retina or refractive error called short-sightedness and long-sightedness. Today's topic of particular interest to those of you who want to know more about two refractive error. My presentation will take about 15 minutes. As we may know, our eyes are exceptionally well-designed camera that uses simple yet intricate optics to make us see clearly. Did you know that eyesight problems are common and often do not occur because of eye disease? People can have healthy eyes but still be short-sighted or long-sighted. The good news is that most people with either short sight or long sight can be treated if they have access to corrective lens in the form of glasses or contact lens. It is also possible to correct many refractive errors by laser eye surgery. To start with, I will talk about the normal vision. Then, I will give you a short introduction on how our eyes work in normal vision. After that, I will talk about refractive errors and the treatments. Finally, I will talk about short and long sightedness. Let's begin by normal vision. You have probably heard this saying, "I have normal vision," but what does that really mean? 20/20 means normal vision. 20/20 is a term used to express normal vision or visual acuity test by reading a Snellen eye card at a distance of 20 feet if you have 20/20 vision. You can see clearly at 20 feet what a person with normal vision can see from 20 feet. Calling normal vision 20/20 vision is true for eye care professionals in the United States, but not everywhere in the world. In Europe and elsewhere, eye care professionals would say that normal vision is 6/6 vision because they use the measurement of 6 meters instead of 20 feet. Can your vision be better than 20/20? Yes, having 20/20 vision means you have normal or average vision. Contrary to popular belief, this number is technically not considered perfect vision. Some people, mostly children, have vision that is better than 20/20, like 20/15 vision or 20/10 vision. This means that you can see something 20 feet away, like a line on an eye chart that most people can see when they are 15 feet away or 10 feet away. That's all I have to say about normal vision. To understand the eye disorder, we must first understand how to help us to see. So, let me turn now to how our normal eyes help to see. Your eyes work in a similar way to a camera. The different parts of your eye work together to help you see image and send visual information to your brain. This process all happens extremely quickly. The front of the eye is made of the cornea, iris, pupil, and lens, and focus the image onto the retina. The cornea is the clear front window of the eye. The iris works like a shutter in a camera. It has the ability to enlarge and shrink, depending on how much light is entering the eye. The lens works like the lens in a camera. shortening and lengthening its weight in order to focus light rays properly. The retina functions much like the film in a camera. It is like a sensitive membrane that covers the back of the eye. This membrane consists of millions of nerve cells which gather together behind the optic nerve. When you look at an object, light reflects from the object, enters your eye through the cornea and goes to your lens. Your pupil gets bigger and smaller to control the amount of light that gets into your eye. Your cornea and lens refract or bend the light to bring what you are seeing into focus. Light reaches the retina at the back of your eye, and the retina changes the image into electrical impulse or signal. The optic nerve transfers that signal to the part of your brain that is responsible for vision or visual cortex. The optic nerve carries signal from both eyes at once. Your brain interprets what you have seen. It combines the visual information from both eyes and brings it all together into one clear image. I have told you about how our eyes work. Let's move on to eye disorder that affect the eye's ability to refract or bend light. It means that the shape of your eye doesn't bend light correctly, resulting in a blurred image. This makes it difficult for the eyes to focus on what is seeing. Depending on the type of refractive error, you might struggle all the time or only in specific situations. The severity of the error determines how much it will affect your vision. Mild errors might hardly affect your sight at all, while severe error may leave you unable to live a normal life without vision correction. You can have a refractive error in one or both eyes. When an error is present in both eyes, it may not be equally severe in both. You can also have different refractive error in each of your eyes. There is usually nothing you can do to prevent a refractive error from developing in your eyes, because they are caused by the shape of your eye, cornea, or lens, or changes to this part of your eyes. There is no way to prevent refractive error. There is also nothing you can do to prevent your child from being born with a refractive error. Refractive errors are extremely common. Around 2.3 billion people globally have one or more refractive errors affecting their sight. There are four main types of refractive error. First, myopia or nearsightedness, difficulty seeing things that are far away. Second, hyperopia or farsightedness, difficulty seeing things up close. Third, presbyopia, an early form of farsightedness that sometimes happens when the lens of your eye hardens over time. The last, astigmatism or blurred vision at all distance. That's all I have to say about what you need to know about refractive error. What are the symptoms of refractive error? The most common symptoms of a refractive error is blurred vision. Patients report symptoms of eye strain and blurring, with difficulty in prolonged reading. Symptoms of double vision, haziness, glare or halos around bright lights. Squinting and headache may also occur. Some people may not notice the Symptoms of refractive error. It is important to get eye exam regularly so your eye doctor can make sure you are seeing as clearly as possible. If you wear glasses or contact lenses and still have these symptoms, you might need a new prescription. Talk to your eye doctor and get an eye exam if you are having trouble with your vision. Next, what is the treatment for refractive error? Eye doctors can correct refractive errors with glasses or contact lenses, or fix the refractive errors with surgery. Glasses. Eyeglasses are the simplest and safest way to correct refractive errors. Your eye doctor will prescribe the right eyeglass lens to give you the clearest possible vision. Contacts. Contact lenses sit on the surface of your eyes and correct refractive error. Your eye doctor will fit you for the right lens and show you how to clean and wear them safely. Fourth, intraocular lens. The intraocular lens is fitted in those people who do not have the option for LASIK surgery. Refractive lens exchange. During this process, the natural lens is replaced with a synthetic lens. The multifocal lens may be used that can focus both on the far and near objects. Surgery. Some types of surgery, like laser eye surgery, can change the shape of your cornea to fix refractive error. Your eye doctor can help you decide if surgery is right for you. That's all I have to say about refractive error and the available treatment option. Let's move on to what you need to know about short-sightedness and long-sightedness. Short-sightedness or nearsightedness is also known as myopia. It occurs when your eyes cannot focus clearly on objects in the distance. You can be short-sighted if your cornea is too curved or if your eyeball is too long. When this happens, light rays coming into the eye focus slightly in front of your retina rather instead of on it, making faraway objects look fuzzy. Short-sightedness causes objects further away to appear blurred, which can affect your vision when you are driving, playing a sport, or trying to recognize people and objects at a distance. This can lead to eye strain, headache, and fatigue. Diagnosis. Nearsightedness is diagnosed by a basic eye exam. Your eye care specialist will likely ask about your child's or your medical history and ask about any medication. Farsightedness or hyperopia make it is fairly easy to see objects quite some distance away, but objects at less than arm's length are blurred. It is the opposite of myopia. If you have farsightedness, you might be able to read what's on a screen on the other side of the room clearly, but will struggle to read notes you are typing on your laptop that is right in front of you. Your eye growing too short from front to back causes farsightedness. Another cause is your cornea or lens being too flat or not being curved enough. These defects cause light rays to focus just behind the retina. People with farsightedness are usually born with it. Also known as hypermetropia, Long-sightedness affects the way you see objects in close range. People who suffer from long sight are usually able to see objects in the distance clearly, but not thus sharply. You can be long-sighted if your eye is too short or your cornea too flat in curvature. These defects cause light rays to focus just behind the retina, so it is fairly easy to see objects quite some distance away, but objects at less than arm length are blurred. This is usually a result of genetics. If others in your family have it, you are more likely to develop long-sightedness. It is possible for anyone to be long-sighted at any age, but it is almost inevitable that you become more long-sighted as you get older. Age-related long-sightedness is called presbyopia, and it develops in most people in their mid to late 40s. It is not a disease but a result of natural aging in which the lens inside the eyes become less flexible. That concludes my presentation today. In conclusion, thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.